Welcome to Overcoming Physician Burnout as Health Architects, a series in which we talk about different ways that physicians can approach their clinical work to make it more rewarding and fulfilling. This is Venkatesh Ramnath. Hi everyone, welcome back. Today I'm hitting pause on our usual programming to bring you an important sidebar, something that's urgent and which is coming down the pipeline in just a few weeks. Medicare is set to roll back its expanded telemedicine coverage. And this change is happening fast, actually April 1st, 2025 to be exact. Given how crucial this is for patients and providers alike, I wanted to share a conversation I recently had on this topic on another podcast called It Could Happen Here. Later in this series, we'll dive deeper into how the health architect mindset leverages technology, including telemedicine, to combat burnout. But right now, we need to talk about what's happening with Medicare and what it means for healthcare access across the country. Let me give a bit of background. During the COVID pandemic, Medicare temporarily expanded telemedicine coverage, allowing patients to connect with their doctors from anywhere, including their homes. That flexibility has been extended several times, but on March 31st, 2025, that is at the end of this month, it's finally expiring. After April 1st, Medicare will once again require patients to be physically present in an approved healthcare facility, like a hospital or clinic, to receive telemedicine services. There are a few exceptions, like home dialysis visits, acute stroke care, and certain mental health services, but for most patients, especially those in rural areas who will probably be affected the most, this rollback could make it much harder to access specialists remotely. So, what can we do about this? Well, if you're a health architect, that is, someone, as we've talked about in this series, who stays ahead of the game, adapts, and takes initiative, this is the time to lean in, not panic. Sure, changes like this can easily disrupt daily practice, but instead of letting uncertainty pull us towards burnout, we can gain the upper hand by educating ourselves on the issues, building trust with patients, and working with administrators to develop sustainable models of care. We tackle these approaches in the latest episode of It Could Happen Here. I joined host James Stout and Dr. Kaveh Hoda, a practicing gastroenterologist and host of the House of Pod, to break down what this policy change really means and, most important, what we can do about it. I highly encourage you to check it out. The episode is called The USA's Impending Telemedicine Cliff, and it's available now on Spotify. You'll find the link in my post. If you prefer another podcast player, just search for It Could Happen Here and look for the episode dated March 5th, 2025. Take-home point. As health architects, the goal is not just to react or be put off by inevitable policy changes, but to proactively educate ourselves, advocate for smarter policies, build innovative care pathways, and ensure equitable access to healthcare services. The rollback of pandemic-era telemedicine flexibilities is yet another reminder that healthcare transformation is an active, dynamic process requiring creativity, adaptability, and leadership, all skills that the health architect brings to the table to maintain poise and a sense of control. I hope you give the podcast a listen. In any case, stay informed, and we'll talk more soon.